delivering health and wellbeing services to small and medium-sized enterprises in the UK, findings from a scoping review. I will start with how we came up with this study, what prompted us to look into health and wellbeing services to SMEs in the UK, and I will put that in the context of the wider research that we are doing on SMEs and health and wellbeing services in SMEs. So I will start with the study inception on a few slides, just to set the scene. So study inception on this project. So a large company, that is Jaguar Land Rover, approached the London Centre for Work and Health as they had a new package of services, health and wellbeing services that they wanted to evaluate its impact on their employees. So back then, that was a couple of years ago, Ira and Vaughan approached me to think about how we could turn this request into an interesting research question. To help them in the process of turning the request into a interesting research question, we expanded and we brought to the team people with expertise in the research question that we thought it was interesting and on which evidence base was needed, and is likely to have an impact on big parts of the workforce. So just to drive you through our process of thinking, this slide summarizes the background that sets the scene on the key focus objective of our study. So we know that safe work is good for people's health, as it provides a sense of confidence and belonging, and employers have the statutory duty to provide a safe working environment for their employees. And one way to achieve that is by providing health and wellbeing services to their employees, which are known to support employees as they can address needs very quickly, promptly, and can also provide support and advice on how to prevent work-related illnesses and injuries. And even though the effectiveness of such services is well established and evident in large organizations, only very few SMEs have access to health and wellbeing services, or more traditionally put, occupational health services. And we know that cost is not the only reason why efforts embedding such services to SMEs are falling short. So that prompted us to think about ways of improving that access to health and wellbeing services in SMEs. Thinking about the structure and the fact that 75%, so about 3/4 of SMEs operate in a supply chain environment, we thought that this structure can offer quite a lot of potential, or an interesting alternative channel to reach SME employees. Of course, we need to mention here that this interest was reinforced by the government's push to improve access to health and wellbeing services, and has recently set up an occupational health task force aiming to increase access and uptake of such services by all employees. And in addition to that, DWP is piloting a subsidy initiative for small and medium-sized enterprises to acquire occupational health services. So these put together, we focused on the objective that you can see here on the screen, to explore how a bespoke model of occupational and wellbeing services adapted from a large enterprise company can be embedded into SMEs within the supply chain to further assess the clinical and cost effectiveness. So that is really can be broken down in 3 different research questions that we aimed to explore, to do the groundwork, to set the scene, to aiming to address the big objective. So the groundwork included 3 different research questions. The first is what models have been developed in the UK since 2000, and what is the current and proposed policy framework for delivering such services? What are the perceived opportunities and challenges and obstacles for delivering health and wellbeing services in manufacturing industries? And we use here manufacturing because we started off with Jaguar Land Rover as a case study. And thirdly, what would be the optimal study design needed to conduct a proof of concept feasibility study? So again, I repeat, we have the big objective, which is looking into a new way of delivering, of improving access of health and wellbeing services by SME employees using the structure of large enterprise and large enterprise organization and SMEs within their supply chain. And in order to achieve that, we looked into these research questions first that could feed into the big objective. So the scoping review that we are talking about today is really the first part of this set of 3 questions. And these questions are really mapped onto a research plan that you can see on the screen here. Which comprises 3 work packages. So that these work packages are the scoping review, the first work package of the existing models of delivering health and wellbeing services to SMEs in the UK. Second work package was a qualitative study to explore opportunities and obstacles and facilitators of providing such services from a large organization to supply chain SMEs. And then information and findings from those 2 work packages fed into a preparation of proof of concept feasibility study, the elements of which feature in a proposal that we have put together for further funding. And I will give a bit of information about the last one at the end of my presentation. So focusing on the scoping review, I repeat here, we were interested to find what models have been implemented and what was the evidence from this research. So we included studies. So the 3 main pillars of our search of our scoping review were health and wellbeing services in SME settings, and we wanted these studies to provide an implementation kind of analysis. So we included studies involving employees aged 16 and older, 16 years of age and older, employed by an SME in the UK. We excluded studies of interventions aiming to support unemployed people back to work and those without any evaluation of either clinical or cost effectiveness of the intervention. We also excluded studies reporting no characteristics of health and wellbeing services, service interventions, or reporting barriers or facilitators and contextual factors for embedding such services, occupational health services, to SME settings, as well as those not reporting clinical or cost effectiveness outcomes of their interventions. In terms of study design, we included both quantitative and qualitative studies using different methodological approaches, such as cluster and individual randomized controlled trials, case control studies, cohort studies, observational studies, while case studies were excluded. And we only reviewed published literature or full text papers. This slide summarizes the flowchart, so the process from identifying the studies down to the retrieving papers and inclusion and exclusion, and the final set of studies included as part of this scoping review. So we, in terms of looking for evidence, we used 6 different databases, and these were CINAHL, Cochrane database, Cochrane Walk and Base, Medline, and PsycInfo. Of those, a very big number of the return of the identified articles, a very big number was removed by the initial screening of titles and abstracts. The records screened in greater depth of the abstract was 213, and after excluding several studies, a very big part of the exclusion was based on the fact that they were not relevant to the research question, but also a big number was excluded because they were not UK based, and or they were not necessarily set up in SME settings, in an SME setting. And the final, after excluding studies, screening down studies, we ended up with a sample of 6 different studies that were considered as eligible, satisfying the inclusion criteria that we set up. There are 3 main domains that we extracted, based on which we extracted information. The first was characteristics of the studies. Secondly, the characteristics of the health and well-being interventions, and evaluation of the intervention, so what results they had. In terms of study characteristics, this slide summarizes the characteristics of the studies, of the 6 studies included in this scoping review. And particularly, we are looking into the sectors in which the sectors of the SMEs in the study, the number of SMEs and the number of employees in the studies included, and the demographic characteristics of the sample population, specifically age, gender, and ethnicity. Now, with regards to the sector, that was the studies that we included had a very good mix of SMEs from diverse sectors: private, public, retail, service, manufacturing, and so on. The number of SMEs across the studies included in this scoping review varied quite widely, from the smallest one in terms of SME units that they recruited, being 10 SMEs, up to a study recruiting SME employees from 109 SMEs. In terms of employees, the smallest study had 16 employees only across their SMEs, whereas the largest study, which used electronic records, had about 12,000 participants, employees. In terms of demographics, across the 6 different studies, across the 3 different studies, we had an average age ranging from about 35 years of age up to 50.5 years of age. There was a good split between females and female-male population, and if any, across the different studies, we had more females than males. With only one study reporting 48% female population. And the rest of the studies being more on the 65-70 split between males and females. And in terms of ethnicity, 5 out of 6 studies had a white population by a prevalence of 90, 91, 92%. With only one study having a smaller proportion of relative proportion of white population, so 75% of white people in one study. In terms of intervention types, the identified studies looked at health promotion, advice and support, or provided health promotion, advice and support. Another one, physical activity and fitness intervention. Behavioral intervention, so walking duration, they try to increase physical activity by increasing walking duration while commuting. Another one focused on the intervention was on case management, provided case management and therapeutic support, including CBT. In terms of referral pathway to intervention, one study recruited all employees, all possible all employees within the SMEs that they approached and they engaged with. whereas the rest of the studies had selected samples based on predefined research focus, for example, employees in long-term sickness absence, or for example, the one looking into improving physical activity. They started by screening their sample for those in lower levels of physical activity. In terms of intervention setting, there was a good mixture between workplace and outside of work. And similarly, in terms of mode of delivery, there was a very good split between those delivering the intervention on a one-to-one basis through consultations or telephone consultations, face-to-face consultations or telephone consultations, but also some interventions acting on the group as a whole. In terms of duration of intervention and measurement I haven't put up here the measurement frequency. I missed that out. So in terms of duration of intervention, the majority, so 5 out of 6 studies included, they had a range between 10 weeks and up to 6 months, whereas there was one study having a duration of intervention of 4 years. And interestingly, I mean, that another interesting point for our data extraction kind of approach was what professionals were involved in delivering the intervention. And that was, so the professionals involved in the interventions in these studies were health promotion consultants, qualified physiotherapists, promotion charities, physical activity, workplace activators, occupational health staff, case managers, physiological therapists and counselors. So quite a wide range, kind of diverse range of specialties and expertise for delivering such interventions. Most importantly here, whether the interventions worked or not, and this slide summarizes the results of the assessment of the effectiveness of the intervention. And I report here 5 studies, as the 6th one was on qualitative data. So it wasn't that straightforward to extract information on exact measures. So across the 5 studies that we have here, there was a kind of positive message that the interventions in SMEs to improve the health and well-being services, interventions in the workplace seemed to have a positive impact on employees' health and work outcomes. So looking at the panel of different outcomes, the first message is that there is a very wide panel of different outcomes, primary and secondary outcomes. And secondly, that there seems to be a positive effect. So for example, I will be using my mouse here. We see a positive effect. So the up arrow means improvement, the down arrow indicates decrease, whereas a slash means that, this sign, the minus sign anyway, means that there was no effect. So looking at this table, we see that there was a positive kind of effect of the intervention on health promotion, knowledge, attitude, but also awareness, quite importantly, and positive mood, but also decreasing stress, more physical and mental health outcomes, like decreasing stress or anxiety and depression, and decreasing presenteeism as a work outcome. So if we are to put this together, the information on effective intervention, there is quite important information on effective interventions in SMEs, but the information is rather scarce. We only identified 6 studies. And across the 6 different studies, there was considerable heterogeneity, methodological heterogeneity, and also a very wide set of outcomes of health and well-being and work outcomes measured. So people measured all different things. However, on the positive side of things, the interventions in SMEs in the UK, so effectiveness of improving health outcomes and changing health behaviours and raising awareness about healthy living, which is a very important message to take from this study, that whatever the target was in terms of health and work outcomes, and also the different structures and types of interventions and the different characteristics of the interventions, they seemed to have an effect on SME employees. So there is a need to, so where does it take us and what is the impact on policy and practice? There is a clear need for focused efforts to develop and implement new initiatives promoting health and well-being. But we need to be pragmatic in terms of our target outcomes, and particularly in terms of the timeframes that we pose to achieve a target outcome. The team behind this study, we have spent a fair amount of effort and time trying to identify, to think about what the target outcome would be. And we felt that improving awareness and workplace culture in SMEs is a very important outcome. And also improving awareness about services that one could use to improve their health. And that could potentially lead to better work engagement and health thereafter. Also, it's worth mentioning here that this is really a hot topic with the cross-party task and Finnish group exploring how to embed health and well-being services into SMEs. So it's very timely to talk about this topic and to think how we can ways to improve health and well-being services access and uptake of such services in SMEs. As I mentioned before, there was that scoping review is only one component of a small pre-program grant that we secured, that we were awarded. That was last April, and information from the scoping review, but also on other research done in parallel as part of the development awards, fed into our thinking and putting together study that forms part of the research collaboration award, which we are firming up and we will be submitting in the next 24 hours. So the next steps, so this slide really summarizes the main research questions that we have put together for further funding as the next step of this research. And these are to establish what services can be delivered by a large enterprise organization to SMEs in the supply chain, to evaluate effectiveness and cost effectiveness of such services delivered this way, and to explore what factors may affect the effect of intervention on outcomes, on health and work outcomes. And to, of course, evaluate the process to understand how, whether this process of delivering health and well-being services works or not, and what are the potential considerations and issues. And perceptions, of course, by stakeholders in SMEs and large organizations. And then as a final step, to approach SMEs and from a cost perspective to understand what SMEs managers and decision makers in an SME setting are willing to engage and pay for health and well-being services through this model. So I will stop here and I will open the floor for questions.